I've spent 26 years watching people waiting for a diagnosis before they trusted what their body was telling them, waiting for a test to confirm what they already knew, waiting for a specialist to explain something that their body had been signaling for years. For most of them, the diagnosis just confirms what their body had already been trying to tell them. They just had never been taught how to read it. I'm Dr. Jennie Luther, doctor and professor of acupuncture and Chinese medicine, 26 years of clinical experience, and now based in Provence, France. Today, I want to teach you the most useful clinical skill I know, one that Chinese medicine's been using for over 2,000 years and that most people with complicated bodies have never been offered or taught. It's called pattern recognition, and it changes everything about how you understand your own health. Here's something that the conventional medicine model does extraordinarily well. It identifies progressed diseases. What it's less equipped for is the territory before that point. Those years when something is clearly off, but the labs come back normal. When you know your body has changed, but nothing is technically wrong yet, at least not on paper. When you're managing multiple misfiring systems, with every specialist thinking about their own piece, but nobody thinking about the whole. Most people with complicated bodies live in that territory for a long time, years, even decades. But Chinese medicine was built for that territory. Not because it ignores Western diagnosis, but because it starts from a completely different question. Western medicine asks, what do you have? And once something has a name, a diagnosis, it knows what to do. Chinese medicine asks something different. What is your whole body doing right now, and why? Not just what's broken. What's your constitution? Where are you depleted? Where are you stuck? How is everything playing together? And that's really the most important question. So you see, it's a totally different set of questions, and it opens up a whole different set of answers. So what does this actually look like in practice? Let me show you. So let's talk a bit more about what pattern recognition actually is. Well, it's exactly what it sounds like. Instead of looking for one thing that's wrong, we look at the whole big picture, the constellation of all of the different things that are happening. And then we read what that whole constellation is telling us, not just the pieces of it. Ironically, I've taught this framework to graduate students for years, and I used it in clinic daily. And there have been lots of times where I really ignored pretty clear patterns in my own body. So just keep in mind that sometimes knowing something and living it are two different skills. And if I could miss it in myself, you missing it in yourself is not any kind of failure. It's just what happens when nobody teaches you to look. But also, sometimes we just get used to things or they come on slowly. And it's sometimes hard to pinpoint where things start. So what does this actually look like in practice? In Chinese medicine, our intakes are very different than a Western medicine intake. We're asking a lot of things that most doctors don't really have time to ask you or don't think about asking it. And sometimes it can feel a little personally invasive, but it's just feedback for us. So it's not just how do you sleep, it's when are you having insomnia? Are you having a hard time falling asleep? Are you waking up too early? Are you waking up in the middle of the night? But also, what is the quality of your sleep and your dreams even? And if you're rested when you wake up. We also want to know, what is your energy doing at different times of day? So when are your peaks and valleys? That gives us a lot of information. We want to know what makes your symptoms better and what makes them worse. And yes, we ask a lot of weirdly detailed questions about your poop and your periods. Not a fetish, it's just because those things give us such a clear picture of what's happening in the whole body. So none of these questions are random curiosities. Each of these things is a piece of data in our big picture. And when you learn to read that big picture, instead of just the points, you stop needing a label to take action. You might notice I always crash at 3 p.m., or maybe right after I eat, or my digestion is much worse when I'm really stressed, or I'm waking up at 2 a.m. with my mind racing, or I'm always cold except for when I have these crazy hot flashes, or my pain is much worse after I rest too much. Again, each of these things gives you a piece of information about the whole body. They're not isolated symptoms. They're a pattern. Each of these things is information about the whole body, not isolated symptoms. They're a pattern, and a pattern tells us what's happening across your whole system right now. Because the body doesn't work in parts, that's not how it works. Everything runs in our bodies in feedback loops, one thing affecting the other. Think about hormones or poor digestion or not getting enough sleep and the cascade effects that each of these things have on many things in our body. And that's why it's so helpful to learn how to spot the patterns before they become a giant tangled mess. Let me give you an example of what this can look like in real life. I had a patient that came to see me in her mid-40s. She's in perimenopause, and it's rough for her. Severe hot flashes, night sweats, mood swings that feel like they belong to someone else, and a short fuse that is wreaking havoc in her relationships. But when I'm taking her full history, I'm hearing something that started a lot earlier. Years of painful, heavy periods, significant bloating and mood swings right before her cycle, and crankiness that she just learned to manage and wrote off as, oh, it's just for a couple days a month. She'd never addressed any of it, not because she wasn't paying attention, but because nobody ever told her that it was something that could be addressed. She just thought it's how periods were. So many women in this situation are put on the pill, sometimes in their 20s or 30s, sometimes even their teens, for painful and difficult periods. And it helps. It suppresses the symptoms. But the pill's not resolving any of the underlying problems in most cases. It's just suppressing the signals. And for a lot of women, the terrain is still there that was causing it, doing what it was doing, just quieter. The real problem is that this woman never knew that the problem could be addressed in the first place. So by the time she gets to perimenopause, it's really showing up strongly because it's been getting progressively worse. And now, as we have these huge hormone swings in perimenopause, the body just doesn't have much adaptability. So here's what the pattern shows me. Those early symptoms and these current ones are not separate problems. They're the same pattern at different points in time and at different severities. And perimenopause has really turned up the volume until it just became impossible to ignore. But I want you to know that our bodies are never random. It was always showing you something. If this is the kind of conversation you've been looking for, please hit subscribe and like this video. It really helps my channel find the right people. There's a new video most weeks, and there's a newsletter subscription if you're interested in the description box. So what does reading all of that big picture look like? Here are the 6 lenses that I use clinically and that you can use in your own life starting today. Chinese medicine doesn't read the body through just one lens. It layers observations from multiple perspectives until a big picture emerges. Here's 6 of these lenses. You don't need all 6. You just need the ones that make your body start making sense. So start with one that feels the most familiar, the place that your body is already talking to you, sometimes loudly. You're not diagnosing yourself. You're just starting to notice. And before we get into this, I just want to remind you that I'm a doctor of Chinese medicine and acupuncture, not a medical doctor. And this video is for education, not advice for your specific situation. Please keep working with your own provider so you always take the best care of yourself. Okay, let's get into the first thing. Lens number 1 is temperature. Does your body run hot or cold? Not just your preference for the room temperature, although that's a piece of it, but your body's actual thermal quality. So do you consistently run warm or cold? Does your body temperature shift unpredictably? Is it hard for you to warm up? Is it hard for you to cool off even when you feel like you should? Are you having hot flashes during the day, chills at night, vice versa? All of these things give us a really good picture, and also where you feel hot or cold can be diagnostic too. So what it tells you. Temperature is one of the most reliable indicators of what is depleted and what is in excess. We call that like a stagnation, an excess. And how it's changed over time is also very informative about where that sits right now. One place that you can start in your own body, if you are running really cold all the time, you should be avoiding cold food, cold drinks. Set down the ice drink. Drink room temperature, or better yet, drink hot tea. Warm up your food and drinks. So you're going to do better with cooked foods and vegetables like a soup or a stir fry versus a salad. Just stop introducing so much cold into your body and do simple things like wearing a scarf when it's windy and making sure you have warm socks on at night when you're trying to sleep. On the opposite side of that, if you are hot or flush all the time easily, you should definitely be avoiding things that create heat in the body. Top among these are things like alcohol of any kind, even wine, coffee, it's very hot by nature, and spicy foods that are adding fuel to that fire. And interestingly, this can include some really, really healthy foods, right? Like spicy foods, cinnamon, ginger. They are very warming and they're used medicinally to warm the body. So if you have too much heat, you're just adding heat to the fire. Lens number 2, full or empty. Is there too much in your body or not enough? We call this excess or depletion. Excess shows up as intensity of symptoms, things like sharp pain or really strong emotional reactions, feeling really wired and irritable or anxious, or inflammation that flares really easily. Think of things that feel like just too much in your body. Whereas deficiency shows up as lack. Most people with chronic complex health conditions are dealing with a mix of both excess and deficiencies in their body. And it's not a contradiction. A lot of times the excess thing has created the depletion, like it's worn you out over time, like chronic inflammation over a long time can cause a lot of depletion. And also the depletion itself can create an excess. Like if you're very yin deficient, very dry, very moisture deficient in your body will try to create damp or phlegm, like to try to combat that, which causes other problems. So this is why things like really strong protocols for detox or big exercise protocols that seem to work great for lots of people tend to not work well for people with both, because they're so depleted in the background, even if it looks like an excess, that their body just doesn't have the oomph to process things because you're already running on empty. So one place that you can start with this, if deficiency sounds like you, stop treating rest as something that you'll do when you've finished everything else. I'm really guilty of this. Rest is the treatment, not the obstacle. And I know personally how much we feel like we have to get done, and we think we're going to have the best intentions to rest, but then we lose track of time. So I get it. I do it. But rest, it is the treatment. Even 10 minutes of genuine stillness where you're not scrolling, you're not planning, you're just resting with your eyes closed, it's a different input than your body has been getting used to. So the same thing can go with excess. Usually if there's a lot of excess, stagnation, pain, we tend to keep adding to it with our same habits. So hopefully after you get through all these lenses, you'll get a better sense of what you need to step away from with it. So lens number 3 is all about flow. Are things moving or are things stuck? So does your body feel like it has circulation? Is energy moving? Is digestion flowing? Are emotions processing? Or are they being suppressed? Does it feel like something's backed up, congested, stagnant, physically, emotionally? Stuck shows up physically as things like digestive sluggishness, or that really tight feeling under your ribs, stiffness that's worse in the morning. But it also shows up emotionally, that same thought that keeps looping for days, an emotion that arrives and just will not move through. You just keep spinning on it. That irritability that's sitting right below the surface of everything all the time, and you don't really know why. In Chinese medicine, that physical stagnation and the emotional stagnation aren't separate. They reflect each other and respond to the same things. Movement is the most direct way to shift stagnation. It doesn't have to be intense. A 20-minute walk after meals does more for your stuck digestion and stuck mood than most people expect. So start smaller than you think, but just try to let things get moving instead of stuffing the emotions or stuffing our bodies or not moving at all, because the movement is the medicine. Lens number 4, timing. Has this been building for years, or is this a recent thing that you're experiencing symptom-wise? Something that's recent and reactive needs a different approach than something that's been slowly accumulating for years or decades. If your health picture has been building quietly for a long time, getting worse and worse, symptoms that started mildly and gradually intensified, or even patterns that are present since childhood or since a particular life event, think like asthma you've had since you were a kid, or maybe since you had COVID, you've had these symptoms. These things tell you that this isn't something to push through or to shock the system out of. It needs tending, not forcing. It's that deep depletion with some excess. So where you can start with this, if things have been building for years, these symptoms that you're really bothered by right now, first, adjust your expectations for the timeline of change. Things that have been around a long time take longer to change, especially if you've gotten really depleted over time. Deep patterns need consistent and small inputs over time, not dramatic, huge interventions. So ask yourself, what could I do every day? Not what could I do one time? Okay. I'm more interested in you thinking about, okay, I'm going to make sure to really eat the 5 full fruits and vegetables a day, instead of I'm going to do this crazy cleanse and then I'm going to eat normal or binge eat and then I'm going to do a crazy cleanse, because you're just exhausting your body and honestly driving the symptoms deeper when you do that. Lens number 5. What does your body actually respond to? Does warmth help or aggravate it? Does movement relieve your symptoms or make it worse? Does stress make everything louder? Does rest restore you, or does it make you wake up feeling worse? Does your cycle make symptoms predictably worse at certain times of the month? So what does this tell you? Your body's responses aren't random preferences. They're information about what kind of support it actually needs. If warmth relieves pain, that points toward cold and deficiency underneath. If warmth relieves your pain, that points towards cold and deficiency underneath. If you feel worse after rest, your body likely needs more movement, more stretching in order to shift the stagnation, not more rest. The pattern of what helps and what hurts is one of the most direct maps to treatment that we have. And a lot of it's really just common sense. So one place to start. Pick the one response that's the most consistent, the thing that always makes it worse or always gives it relief, and write it down. One sentence. Then ask, am I regularly doing more of what helps or more of what hurts? And that question alone can change a lot. Okay, lens number 6, mind and spirit. Where is your inner life right now? Is your thinking clear, or has there been a fog for a long time? Are you having difficulty concentrating? Do you feel present and connected to yourself? Or is there this sense of flatness, of disconnection, avoidance, and just going through the motions? Are you carrying grief that hasn't had any room to move? Are you worrying so much that it's just become background noise and you feel like you can't stop? Is there anger that keeps coming over and over again, even when it seems like it really shouldn't be there? Is there fear that's sitting quietly, or maybe not so quietly, under everything else? So what does this tell you? Chinese medicine tells us that each emotion has a home in our body. Grief tends to settle in the lungs and the chest. Worry sits in our digestion. Think about how tight your tummy gets when you're really stressed out, when you're really worried about stuff. Anger tends to sit in our liver. Fear tends to sit in our kidneys and our lower back. And anxiety tends to sit in the heart. When an emotion keeps returning, it's not a character flaw. It's a signal about where the body needs support. Your emotional life and your physical symptoms are often the same pattern, just described in two different ways. Where can you start to deal with this? Notice which emotion you keep returning to over and over, even when it doesn't seem quite appropriate for the situation. It's not the one that flares dramatically, although it can be, but it's just the one that's always there, kind of underneath it, underlying everything. Name it, and then ask, where do I feel this in my body? That connection between the emotional and the physical location is the beginning of starting to read this lens and getting a little more thoughtful about our responses to things. So what does all of this mean for you? Pattern recognition gives you something that no diagnosis alone can. It gives you agency before the label. You don't have to wait to be told what's wrong. Whether you're navigating perimenopause, managing a chronic condition, or just know that something is off, you can start noticing what your body's communicating and make smarter decisions about it right now. What you eat, how you move, when you rest, what you say to your doctor at your next appointment. This is not a replacement for medical care. It's a complement to it. So go to your appointments, do the tests, take the medications that are working, and bring what you've noticed with you. Knowing your body well enough to describe what it's doing, clearly and specifically over time, is one of the most useful things that you can do in an exam room. That's self-advocacy. This is a use for both approaches, Eastern, Western, natural, allopathic, not either or. This is a skill that I teach in everything that I make here. Not protocols, not supplement stacks, and it's not somebody else's morning routine. It's how to read your own body. And once you know how to read it, you can start working with it. Your body's been trying to tell you something, and I teach you how to listen. So leave me a comment. What is one signal that your body's been sending that you've been explaining away? I read everyone, and your answer might be the next video. Subscribe if this is the conversation you've been looking for. New video regularly. Next video, we're going to be talking about how you don't need a perfect plan. You just need to get moving and start changing things little by little. It goes hand in hand with this one, and it leads somewhere good. So, all along, I want you to remember, life is worth living. I'm Dr. Jennie. A bientôt.